Cancer Care Northwest has been around for about 40 years, and it's a physician-owned practice, which makes it unique. One of the things that's really wonderful is that it's an integrated practice. So we have radiation oncologists, medical oncologists, and surgical oncologists all operating within the same building, in addition to our nurses and our support staff. We're really just a big team, kind of working together and making sure that the patient gets the best care that they need without having to go to clinic after clinic, and you're going here for radiation and here for chemo. We're trying to kind of keep everything all integrated under the same roof. Basically, we would just want to reduce any barriers to treatment that the patient is facing. Cancer Care Northwest has 7 clinics throughout Eastern Washington and Northern Idaho, as well as 4 outreach clinics. Patients come in from all over Washington, Idaho, Oregon, Montana, and then I was even on the phone with a patient the other day who's coming in from Alaska for a surgery. The Community Cancer Fund has been a really great partner to Cancer Care Northwest, especially through their Davenport lodging program, and they're able to immediately find lodging for patients, especially when their treatment changes, and when things are medically necessary, that program is right there. The Community Cancer Fund provides on average about 40 to 70 rooms per month for Cancer Care Northwest patients and their families. We did have one patient who was coming in for his first chemo treatment from Moses Lake, and his body's reaction to it, he just got so weak and so tired. And I think we are really blessed to work with the Community Cancer Fund, and their program with the Davenport was able to immediately find him a room. We didn't have to wait. I didn't need advance notice. I was able to get him a room right away and provide that comfort to the patient. And the Cancer Care Northwest is able to say, hey, we're going to take care of you and make sure that you're safe. I've had patients who, after I've interacted with them and helped them get lodging or helped them just find a ride to their treatment, they, have given me a hug and just said, thank you so much. I don't know how I would have gotten through this without you. I've had patients with insurance problems, or their insurance was cut off, and they come to me crying, and I'm there and I say, hey, I'm here and we're gonna figure this out together, and let me see what I can do and who I can call for you, and no matter what, I'm gonna be here, and we're gonna get this figured out together.